Good morning everyone. I'm Sumana, Assistant Professor in Department of Psychology, St. Joseph's Degree and PG College. So today we are going to discuss about risk factors in heart diseases. So as part of this GE course. So why we need to discuss about coronary heart diseases? Yes, when we are talking about stress and its management, and what is the need to talk about coronary heart diseases? Yes, so there is a strong connection between stress as well as heart diseases. People who ever experiences higher levels of stress, definitely it can lead to various heart diseases like arrhythmias, chest pain, heart attack, yes, atherosclerosis. These are the various coronary heart diseases people do experience. And in the present scenario, if you see the statistics, there is a huge, what we can say, there is elevation in these heart diseases irrespective of the age, gender, caste and all these things. Yes, so it's quite important for us to understand what are the risk factors. Can you say what would be the reason, apart from stress, what would be the other reasons or other factors which can contribute for this heart diseases? Any one of you? So, yes. So aggression, diet, yes, the situations what they face, and their genetical structure, their physiological structure, their behavioral pattern. There are various things which can contribute for this heart diseases. If we categorize all these factors, then we can see first comes the biological factors which are not under the control of an individual. Yes, we cannot alter these risk factors. So hereditary factors plays a major role. So when we talk about the age and the gender, yes, so earlier it was seen like 45 and above, the age group are more vulnerable to this heart diseases. But presently we can see that irrespective of the age group, everyone is suffering with this cardiac arrests, yes, various heart diseases. So especially 45 and above in men and 50 and above in female are observed who are very much vulnerable to this heart diseases. Yes, and it is more in men, but still female who are very close to menopause stage, because their hormonal changes do takes place in this phase. So it is more dangerous for female if they have any sort of heart problem. Yes, so it is based on one survey, it was observed that out of 100 female, 80% of the female, there is a chance that with one heart stroke or with one heart problem, there are high chances that 80% of female can die, whereas men, the rate is only 30 to 50%. Yes, so yes, it is high in male, less in female, but intensity is more in the female. Next, if you see other biological factors, we cannot ignore the family history. Yes, so genetical factors which we cannot alter, but still if people get to know that if this heart diseases are running in the family, then they can take some preventive measures to protect themselves. Yes, they can do take care of their dietary measures as well as their regular exercise. Yes, certain behavioral patterns, certain habitual things can protect them even the heart diseases are running in the family. Yes, we cannot alter the genetical structure, but through preventive measures to some extent we can reduce the intensity. Yes, even hypertension also a comorbid symptom. Yes, what exactly? Elevation of blood level. Yes, blood flow. So if a person has this recurrent blood flow or higher levels of blood flow into the body, if they are ignoring, then it might lead to various coronary health conditions. Yes, heart problems. So identifying this blood pressure levels is difficult. That's the reason regular checkups, yes, screening is mandatory to identify the symptoms of this blood pressure. Next concepts, if you see in the biological risk factors, high cholesterol. Yes, earlier it was, if you observe, before this 10 to 15 years, only Western countries are more into this obesity. But it has now come to India also. Yes, so now the Indian population are very much suffering with this obesity. What could be the reason for this obesity? First, the food. Yes, the lifestyle. So people are very much consuming this junk food compared to the home food or the vegetable nutritious food. Then diabetes. Diabetes, we can say this is a mother disease. Yes, diabetes is considered as a mother disease. So what exactly happens? If a stress is associated with diabetes, that will increase the risk factor for heart disease 20% more. Yes, double the risk a person can have if diabetes is associated with stress. Then obesity, we already discussed about. Lifestyle choices. So what exactly the lifestyle pattern is? We all are now having this sedentary lifestyles. Yes, there is no much physical activity over here. Apart from that, if a person has this habit of cigarette smoking, yes, the chemicals what are actually included in that smoke, that will pile up into the arteries and that will damage the outer line of the arteries, and this will obstruct the blood flow into the body. Yes, when the blood flow is not happening, yes, there is no proper blood flow is taking place into the arteries, that leads to various heart diseases. Diet and alcohol, we already discussed about diet. So here two things we need to know. Nutritious food and junk food very frequently we do talk about, but what exactly is there in this nutritious or junk food? Yes, so here we need to talk about lipoproteins. Yes, so high levels of lipoproteins are required for our body, but when we consume this junk food, yes, highly saturated food, and this will have low levels of lipoprotein. Yes, so this low levels of lipoprotein easily forms the cholesterol into the arteries, and this lipoprotein will definitely going to obstruct the blood flow. So all the heart diseases whatever we are seeing, its a major cause is obstruction into the blood flow. Yes, whatever this cholesterol will pile up into the arteries, and that will reduce the capacity to flow the blood into the arteries. So in that, what would be the reason? Yes, our dietary patterns would be a major reason. So low levels of lipoprotein will have this, this will actually pile up the cholesterol into the arteries. So always we need to check whether we are consuming high levels of lipoprotein or not. Yes. Excessive alcohol consumption also is a major cause, a leading cause for heart diseases. Then behavioral risk factors. Just know whatever we have discussed all comes under biological factors. Under this biological, few are under our control where we can alter, like smoking or sedentary lifestyles or alcohol consumption. These things we can control, we can modify, we can alter them. Yes, but only the genetical factors, physiological factors which are not under a person's control, but still preventive measures are helpful for an individual to deal with this heart attacks. So behavioral risk factors, major factors are this stress and sleep. So poor stress management. Whenever, what exactly a stress is? It's a bodily reaction towards some pressure or some threat. Yes, how our body is reacting to it. So whenever a person get exposed to stress, some challenge, some threat or something, then we do use, knowingly or unknowingly, we do use some defense mechanisms or coping mechanisms, yes, to deal with this stress. So if a person is not able to maintain an adaptive coping strategies to deal with the stress, that leads to various, it might leads to distress, which is negative stress and which is unhealthy. Yes. Next, sleep. Sleep again plays an important role. Most of the people thinks 8 hours sleep in any time in a day can be helpful for them to maintain that energy. It's a myth. Yes. Only the 8 hours sleep during night hours, especially between 10 to 5 is the ideal sleeping hours. Okay. So after sunset only, if a person is sleeping, so it will be release the substances to maintain the energy into the body. Yes. So lack of this sleep or prolonged sleep disturbances can lead to heart diseases. Then psychological risk factors. So if we see in the present scenario, there are various psychological disturbances are taking into the family. Yes, every person are suffering with something than the other psychological disturbance, maybe a stress, anxiety, depression, mood disturbances, could be anything. Yes, we can read the list, a long list. So how these psychological factors can contribute for a physical problem such as heart disease. Yes, so as I already told you, stress is a psychological factor but has a strong relation with heart diseases. So if we see the psychological risk factors in that chronic stress is a negative stress. Yes, persistently if a person for a longer period of time exposed to stress, then continuously the stress hormone cortisol releases into this body. Yes, and this cortisol is responsible for releasing the glucose. Yes, so what happens? Excessive release of glucose will pile up into the arteries. Again, it is obstructing the blood flow. So that's how chronic stress will increase the risk of heart diseases. Then social isolation. There are various studies conducted on people's socialization. Yes, people who are more socialized and who likes to be with the people, they are less prone to various psychological disturbances. Yes, so due to stress or due to various other health conditions or due to any other reason, if a person is isolated, not really mingling with people, not into the society, then it might increase the risk for this heart diseases. Emotional health. So even depression and anxiety, these two factors also contribute a lot for heart diseases. People who ever undergoing with this depression for a longer period of time. Yes, so depression is not like 1 or 2 days feeling sad or being sad is not depression. There is a clinically proved criteria to identify the depressive symptoms. Yes, so people who ever have actual true depression and anxiety symptoms, they are very much prone to heart diseases. Then hostility and type A behavior. So hostility actually talks about people's behavioral pattern. Yes, so hostile people are more aggressive in nature and they are more suspicious in nature. Yes, they might not understand from others' perspective, and there is a behavior called type A personality, and even this behavioral pattern also very much riskier for heart diseases. So what exactly happens in this type A? What is type A personality factor? So type A personalities are people who actually, mostly we do check this type A, type B behavior in organizational settings. Yes, so team leaders or employees who are more goal oriented. Yes, who are always looks for completing their tasks. Yes, task oriented and always irritated, aggressive, they comes under the category of type A. So they are more vulnerable to this heart diseases. because they are more restless. Yes. Next, so these are the various important risk factors which can contribute heart diseases. We know about these risk factors, but how we can manage ourselves. Yes, we all might be facing these risk factors. We all might be vulnerable for heart diseases, but how we can prevent ourselves. So there are various preventive measures, especially for psychological risk factors. We can follow stress management strategies like yoga, meditation, therapeutic techniques like CBT, DBT. All these can be useful for relaxation. Yes, once a person is relaxed from their situations, from their challenges or threats, then to some extent we can, by using or by adapting these relaxation methods or strategies, to some extent we can reduce this risk factors for heart diseases. Thank you.